When a patient contracts Hantavirus Pulmonary Syndrome, or HPS, the outcome is often a coin toss. In the Americas, this rapidly progressing respiratory disease carries a mortality rate that reaches 50%. Despite decades of research, medical science has yet to produce a globally licensed vaccine to prevent the infection or a specific antiviral drug to cure it. For a patient with a confirmed diagnosis, this creates a terrifying medical void. Doctors cannot administer a pill or injection that directly kills the virus. Because modern medicine cannot eliminate the pathogen, survival depends entirely on the patient's own biological endurance. This forces doctors to shift their strategy from curing the infection to stalling its effects. This strategy is known as supportive care, the primary clinical response to HPS. The treatment is defined by the unique way the virus attacks. It doesn't actually destroy the lungs directly. Instead, the damage is caused by a massive, hyperactive overreaction from the patient's own immune system. This immune response targets the blood vessels, causing the walls to become permeable. Plasma begins to leak out, rapidly filling the patient's lungs. Since there is no way to stop this immune storm once it begins, the goal of medical care is to help the body survive long enough for the reaction to pass. Supportive care functions as a mechanical bridge, physically sustaining vital organ functions until the immune system naturally stands down. During the first 5 days, the prodromal phase, HPS is notoriously difficult to identify because the symptoms mimic a standard flu. If a hospital suspects hantavirus in this window, the first stage of intervention is highly conservative, focusing on basic supplemental oxygen and strict monitoring of fluids. This monitoring is critical. As the patient enters the condition and provides aggressive IV fluids, a standard treatment for dehydration, they will actively accelerate the fluid buildup in the patient's lungs. In these first few days, medical intervention is a delicate balancing act, maintaining blood pressure without accidentally drowning the patient from the inside. As the patient enters the cardiopulmonary phase, their condition typically deteriorates within 24 hours. The onset of severe pulmonary edema means the vascular leakage has overwhelmed the lungs, making basic oxygen masks ineffective. This requires the second stage of intervention, mechanical ventilation. Doctors must intubate the patient to bypass their failing airway. The ventilator uses positive pressure to physically force oxygen through the fluid that has filled the lungs. By replacing the mechanical function of the lungs, the machine buys the patient hours of oxygenation as their own respiratory system reaches total failure. In the most severe cases, the systemic stress leads to cardiogenic shock, where both the lungs and the heart fail at the same time. This triggers the final escalation of intensive care. This reliance on life support persists because current pharmacological options are limited. This is Moderiba, a brand of the antiviral drug ribavirin. While ribavirin is effective against the renal strains of hantavirus found in Europe and Asia, clinical trials have shown it has no benefit for patients with HPS in the Americas. Since pharmacology currently fails these patients, survival remains strictly an engineering problem that depends entirely on intensive mechanical support. Research is now shifting toward preventing the infection altogether through the development of targeted DNA and RNA vaccines. Because hantavirus hotspots are in remote, rural areas, delivering these vaccines is a major logistical challenge. Most vaccines require constant refrigeration, a cold chain that often doesn't exist in these regions. A new technology called insilication could solve this. It wraps vaccine proteins in protective silica cages, allowing them to remain stable at room temperature without any refrigeration. Until these next-generation vaccines are globally accessible, survival depends on the speed of clinical intervention. Identifying the symptoms during the initial flu-like stage and securing immediate ICU support provides the only consistent path through the